Welcome to the Eye Clinic. This video is about eyelid disorders and how they can affect your vision.
Probably the most common lid condition that we come across here at the eye clinic is a condition that we call blepharitis. Years ago, people called the granulated eyelid, and that's where the eyelid kind of gets irritated and causes a lot of aggravation to the patient. The eyes become gritty and sandy and burn, and it's a common problem. In fact, it's usually the underlying problem of styes. And sometimes if a stye develops, then we can treat that medically, or we sometimes have to treat it surgically. Other common lid conditions, one that bothers people, a lot of people as we get older, is a condition where the upper lid skin gets excessive and starts falling down, and it hoods over the lashes. And if that happens, that can decrease their upper field of vision. If it decreases it to a certain extent, then we can do surgery to remove that excess skin. That's called a blepharoplasty. And it's a procedure that, if we can document that it's decreasing their field of vision to a certain extent, then insurance companies will reimburse it. If it's not, then they consider it a cosmetic procedure and will not reimburse it. Another one is where the upper eyelid just droops. People can be born with that. It can be congenital ptosis. Ptosis is the term that's used for a droopy eyelid. Often something that becomes more noticeable as we get older. The muscles that are responsible for lifting the lid just get weak, and the lid then droops. And the only way we can fix that is to surgically lift the lid. The more common conditions that affect the lower lid is a condition where, again, the eyelid, the lower eyelid kind of falls away from the eye and starts hanging away from the eye. And when that happens, the inside lining of the eyelid dries out and gets irritated and red, and just causes a lot of aggravation to the patient. And the only way we can fix that is to tighten up the lower lid and bring it back up against the eye. Another condition that is fairly common with the eyelid is sometimes, again, the eyelid will turn in on itself. Kind of the lashes then turn in and start irritating the surface of the eye, called an entropion, and we have to fix that by doing an operation that sometimes we do here in the clinic. Sometimes it requires a little more invasive procedure we have to do at the surgery center. If somebody has a lid problem that they need surgical correction, that's often done at the surgery center. It's outpatient surgery. Most of them are done as an outpatient. They don't have to spend a night in the hospital or anything like that. And normally we perform the surgery. The patient's awake. We do give them a sedative. We do numb up the eyelid. They'll feel us doing some things to the eyelid, but it's not really that painful. There are some restrictions on patients after eyelid surgery. We ask them obviously not to rub the eye. We don't want to do them any bending and lifting for a few days. Other than that, they can do pretty much their normal activity, just nothing strenuous. And obviously, the most important thing is no rubbing. And there are some care to the lids too. We will have them put usually ice compresses on for a couple of days. We will have them keep the incisions clean, and often prescribe a little antibiotic ointment to use on the eyelid.